Well, welcome everybody. Let's go ahead and kick things off. I think we will probably have a few more people joining us, but we are so excited for all of you to be joining us today to kick off and continue to kick off Newborn Screening Awareness Month this September. Here at Expecting Health, we are really excited about this month as we celebrate 60 years of life-changing achievements. And this is our first webinar of the month, and we are just delighted to be joined by 3 of our newborn screening ambassadors. And I'm going to give them some time in just a little bit to share a little bit more and introduce themselves. But what I can tell you is that we are in for an incredible treat today, learning from these 3 individuals who have had very unique and very interesting stories as they've gotten connected to the newborn screening community. And really, as we were thinking about celebrating 60 years of newborn screening, what a milestone over this next month, we really wanted to take the opportunity with this first webinar to highlight the most important aspect of newborn screening, and that is families. And while we'll talk about a lot of things throughout the month, and we'll celebrate a lot of the achievements from the past, the present, and even the future of newborn screening, none of it would really be possible without the lived experience and the insight that we gain from each of the families who are a part of the system. And so we're really excited to be joined by these 3 wonderful individuals who are going to share more and teach us all along the way about their newborn screening journeys. Before we jump into that, I was just going to lay out a little bit of what to expect over the next hour. And as with a number of the webinars that we host here at Expecting Health, we really want this to be a conversation. We feel that from these questions and from conversation, we really have the opportunity to dig deeper and learn a lot more. And so while I'll spend a little bit of time here at the beginning of the webinar, just sharing some brief information about our Navigate Newborn Screening Ambassador Program and bringing everybody up to speed on what that is, really what we hope to do is spend the majority of the webinar just in discussion with Christina, Dionne, and Ryan, learning more from their experiences. And we have some questions planned for that. We invite you, as well as we're chatting, to share any thoughts or questions in the chat box. We will be monitoring that throughout the webinar. And certainly want to leave some time at the end to bring up any of the questions from the audience. So please do feel free to drop those in the chat box at any point in time, and we'll come back to them at the end. And then lastly, we want to leave you with some specific actions. In talking about all of this and in learning from the lived experiences of these 3 wonderful people, really want to walk away with some very concrete things that you can do next to continue to drive and build awareness for newborn screening and to really continue to share the stories that we'll hear and learn from today. So with that, I wanted to first start by sharing a little bit about the Newborn Screening Family Education Program and the vision and mission of where this ambassador program actually grew from. So the Newborn Screening Family Education Program was a 5-year HRSA-funded program, and we'd like to thank our partners at HRSA for that funding that just concluded on August 31st of this past year. And really the vision of that 5-year program was to build activities and generate awareness, education, training, and knowledge for all families to learn about newborn screening. I think, most of you all listening in today are connected in some way to the newborn screening community and understand that many families don't learn about newborn screening or get connected to that system until after their child has either received an out-of-range newborn screening result or a diagnosis. And so for this reason, this program was funded and really focused on activities that would raise awareness and build knowledge around newborn screening so that all families would have equitable access to that information. And not only have access and knowledge, but have the confidence to participate and lead within that newborn screening system. And so one of the very specific projects that was facilitated through the Newborn Screening Family Education Program was our Navigate Newborn Screening Ambassador Program. And this program was conducted over the last 2 years. And essentially through this program, we've been able to build a network of trained family leaders in newborn screening. And so over the course of 2 years, we facilitated 2 independent cohorts of family leaders that went through an application and selection process to participate in this training program. And then over the course of about 10 months, engaged in various different education and connecting and learning activities, from online training modules to live trainings, and most importantly, to connecting with each other and others in the newborn screening system. And so we were able to identify families and family leaders who have a very wide array of connection and experience within the newborn screening system. And this was very intentional in the way that this program was designed. So we had family leaders who had children that have been diagnosed through newborn screening. We have families who have other family members who were diagnosed. We have individuals who were not diagnosed through newborn screening, but diagnosed later in life and have, through that journey, become advocates for rare disease and newborn screening. And you'll hear as well from others today on our panel that didn't have a family member or a child diagnosed through newborn screening, but through their personal experiences, through their career, through various different aspects of their journey, they've grown to be advocates and grown to be passionate about newborn screening. So through this network, we've really been able to engage and learn from these family leaders and have created opportunities for these family leaders to not only share their story, but to connect to others within the newborn screening system as well. There were three main objectives for ambassadors participating in this year-long program. The first was to facilitate connection. That was connection to each other, those within the program, but also to facilitate and build community with other stakeholders in the newborn screening system. And through opportunities like this, as well as many others that were facilitated throughout the program, really the core and central piece of success was the connections that were built across the different stakeholders that our ambassadors engaged with. The second element, or the second aspect of, or goal, I should say, for ambassadors participating in this program was to build knowledge, to build awareness, to build community. And so, as I mentioned earlier, we did that through participating, in various different quarterly online trainings. Each quarter, the ambassador group would meet together and discuss the online training and discuss various different leadership aspects like connecting with others, learning to share your story, and various different leadership and advocacy skills that through that group learning and through that collaboration, we're able to build and develop those skills even further. And finally, and certainly not least, perhaps even most importantly, was to identify opportunities like this and others where each of these ambassadors could find ways to serve and lead within the newborn screening community. Many of the ambassadors coming into this program had knowledge already of newborn screening or were already participating in some activities. But as you'll see in just a moment, we were able to measure actually some of the confidence levels and some of their involvement prior to and at the end of this program. And we were able to see that through this program, the confidence, individual ambassadors' confidence in their ability to lead certainly did increase. So to that end, we, as I said, at the beginning and the end of each year, we're able to ask the ambassadors to share some of their personal opinions and feedback and experiences about their confidence in their leadership skills and the activities that they were participating in, and in their confidence to share their story. And while I won't go through all of the details and the data today, if anyone's interested, I'm happy to connect with you at any point to talk further. But what we did see clearly in both years of the program that we were able to facilitate this, that overall the confidence in an individual ambassador's leadership skills did increase from the beginning to the end of the program. So we asked about their confidence to serve as a leader, to talk to other families about newborn screening, to talk to healthcare professionals about newborn screening, and where to find information. And we saw clear increases at the beginning, we saw clear increases at the end of the program and each ambassador's ability and confidence to do this. Before we jump in and start chatting with each of our ambassadors, because that's really what we're here for, I wanted to also just share, I think this is so interesting. We ask each ambassador to share some specific skills that they feel like they have gained through the program. And I think, one of the most interesting things that we saw, and you'll probably hear this in some of what's shared from Christina, Dionne, and Ryan today, is I think coming into this, ambassadors thought, I have a lot of knowledge about newborn screening for some. Others thought, I have no knowledge of newborn screening. And regardless of what point an individual came into this program, they walked away feeling they had gained tremendous skill, tremendous connection to others in newborn screening, and a depth of knowledge that they maybe wouldn't have had if it weren't for the ability to connect with and learn from others who had similar yet very different experiences. So while everybody was connected through newborn screening, each ambassador may come from a different condition group or a different way to diagnosis or a different connection. And it's through all of that that really their skills and confidence were deepened at a level that maybe wasn't expected. And so you can see from some of these quotes that there was certainly a tremendous amount of learning and confidence gaining and skill strengthening that happened throughout the course of each year of this program. And so with that, I am going to stop sharing my screen in just a minute and turn it over to our lovely ambassadors to share a little bit more about themselves, their journey to connect with the ambassador program, and more specifically, their journey with newborn screening. So I am super excited to introduce to you all Miss Christina Andrews, Miss Dionne Stalling, and Mr. Ryan Colburn. And with that, I'm going to stop sharing. I'm actually going to turn it over to Christina, if you don't mind going first and just introducing yourself and sharing a little bit about your journey.
Sure. My name is Tina Andrews. I am in my car. Was not planned to be here. Hopefully you can hear me. I am a mother. I'm a adoptive mother. I'm a foster mother to 6 in Maryland, ranging in age from 8 to 19. And today is the first day of school for us, so it's been an exciting day. I am also, I have been a doula for 24 years, and I am a project coordinator of a doula program, a community doula program, which informed originally the reason I wanted to get involved and learn more about newborn screening for my doulas who are working with families, vulnerable families in our community, and who needed the information. It turned out I learned a lot more and I connected in other ways, but I didn't anticipate that when I began. I also am a student midwife, and so I get to see newborn screening in that aspect as well. I'm a home birth, a student midwife for out of hospital birth, and so I do newborn screenings, and I talk with families about why it's important and what they can expect. And so I've really been affected by the program and just by understanding it myself and being able to communicate that to the people that I'm working with, both the doulas and then actually the clients and the parents that I work with. So, and I don't know if there's anything else.
No, that's super. It's really, I mean, again, as you and I have talked about many times, I think when we often think about stories that connect families to newborn screening, it's through a diagnosis. And I think you have an incredible story of, how you've navigated the newborn screening system, and how you've helped support families who are navigating that same system. So it's super interesting to hear how you got here. Dionne, let's have you introduce yourself if you don't mind, and go next.
Hi, I'm Dionne Stalling. I am a rare disease patient with 9 rare disorders. I got my first diagnosis at the age of 45, which took me about 7 minutes of questions for the immunologist to say, I think I know what's wrong with you, but we need to blood draw give you some vaccines, and I need you to come back tomorrow. And when she gave me that diagnosis, she told me it was one of the primary immune deficiencies I was born with. And so that kind of sparked like something in me. And not for long after I was diagnosed, I don't remember the year, but I don't remember the year that you all had the newborn screening boot camp in Chicago. And I applied to go, and I took the train to Chicago, and I met with some magnificent parents. I was at a table on each side of me, were moms that had lost their children. One was not screened at birth because the illness that her child had, I can't remember what it was. I have it written down somewhere, but her child had something that that wasn't on the RUS list. And then the other woman had a child that she lost, but her second and third child survived. And that made me really inquisitive about the whole process of newborn screening. We all know, we see the Band-Aids on the babies when they come back to us, but we really don't understand what the whole process is. At least I didn't. When you have a child. And in 2020, I started Rare and Black, which is a nonprofit organization that raises awareness to empower and uplift Black patients living with rare conditions. And we do that through advocacy, legislative, driving legislative changes, and education. And so this program, this avenue to learning about newborn screening was something that was personally important to me, but also I wanted to learn more so I could help the families that we aim to support. And I was invited by another, the Liz Carter in the first cohort, to come to a webinar. And I didn't think that I fit because I don't have a newborn screening. My children were born healthy, and I didn't have any family members or anything like that. I'm curious by nature. And I had a few questions for you all, and you answered them, and I decided to join the cohort. And I've learned so much from the other two that are on here. Christina helped me because here in Missouri and in Mississippi, I am working with the states and some professionals about trying to educate. And so Christina helped me with the rural part about cultural differences with people that live in isolated areas and communities. And then Ryan helped me so much with the research part, the technical part that I was totally missing. I was overthinking things, and he simplified them for me. So that's why I became, and I'm so glad that I did.
We are too. Thanks, Dionne. And last but certainly not least, we'll hear from Ryan.
Yeah, so hi, I'm Ryan Colburn. I'm in Los Angeles, California. I was not newborn screened for my condition. That's not how I got my diagnosis. But my mindset is something like, I don't really see the difference between some kid born tomorrow and myself when it comes to the importance of newborn screening. So with that, I'm a huge fan of the program generally, or any kind of these kinds of programs that give people an opportunity at improved health. And so I get genuinely excited for each new friend I make in my disease community who has just sort of a different prognosis, a different outlook based on newborn screening, getting a timely diagnosis from newborn screening, even if it's scary as hell for them at the beginning of that. As a ongoing concern, I think there's a lot of work to do and a lot of opportunity that comes from this very basic idea that we should look for things that we can do something about. One is making that experience less scary, making newborn screening, changing the narrative around newborn screening to be really this cool checkpoint. You know, when you're buying a car, BMW had their big thing that even used cars had like a 128-point checklist, and then Toyota had to do a 213-point checklist, and it became this competition of like, I had this higher quality, better checked out thing. And I think newborn screening has that same sort of thing if we view it the right way. Like, hey, we've had a more thorough experience looking for things that we can do to manage our health of our newborns and loved ones. As a public health concern, I think newborn screening is widely underappreciated, of course, for its ability to positively impact individuals, families, and their communities, but then also for this ability to contribute to a growing set of knowledge. So even at a very high level, de-identified, not approaching anything that would violate sort of personal information. or privacy kind of discussions, there's a ton of information that transforms our understanding of condition, and that sort of more closely aligns with what my current relationship is to newborn screening. I have started engaging in my own research that I thought that I'm not doing because I think I'm particularly passionate about this area of research, but I'm particularly frustrated that nobody is using this data to develop new knowledge, new understanding that helps us to learn and help people faster and in more meaningful ways. So yeah, I think newborn screening is great, and have engaged that ecosystem from tons of different perspectives, and looking forward to continuing that journey with all my new friends that through the ambassador program, and then just sort of as we go on in the rare community.
Thanks, Ryan. And thanks to all of you for sharing a little bit more. It really, as I said earlier, and as I've said to each of you, I think it really does just highlight that everybody has a connection and experience that connects them to newborn screening. And oftentimes, even Dionne, you've said this, you felt like you didn't have a newborn screening story, but the reality is we all do. And I think each of you has been able to teach all of us what that journey can look like, and how those experiences can shape why newborn screening is so important to all families. And so just thanks for each of you for being here and for sharing with us. I'm going to kind of transition the conversation into some terms that I know we've talked a lot about, but others who are joining, because we have a very diverse audience that's joining us today from newborn screening laboratories, from research, from other families. And some of these kind of terms that we talk about in the ambassador program may not be things that everybody is familiar with. So we talk a lot about family leaders and newborn screening, and creating opportunities for family leadership in newborn screening. And I'd love for each of you to just kind of take a turn in sharing, what does a family leader in newborn screening mean to you? Because it really is different for everybody. So Dionne, I'll start with you this time, if you don't mind, but if you could just elaborate a little bit on kind of what does that mean to you? What do you think a family leader is, and why do you think that's important to have in the newborn screening system?
Well, to be honest, I think all of us are family leaders. Like, we all, whether we birth children, we are part of either biological or chosen families. We can be a mouthpiece, an educational tool to someone to be able to help them try to figure out what newborn screening is. Because before I got involved with, before I got diagnosed, I didn't realize that there were so many moving parts, right? When I don't know if on one of the calls, the newborn screening ambassador calls, or either it was a phone call with Twina, I think I had this big, I have a tendency to bite off more than I can chew. I had this thing that I'm gonna go and the top 10 counties where Black people live, I'm going to do this newborn screening study, and it's going to be wonderful, fine, and I'm going to publish this paper and all the things. I didn't realize that every state is different, that every state handles their data differently, right? But I'm the person that my family and my friends go to for resources. And so if you think of yourself as that go-to person, you want to be educated about the process. At least I do, about the processes. And I think that family leadership, the first time that I heard that, I think it was maybe Molly said something, and I was like, I don't think I'm a family. Like, we get caught up sometimes in what we are and what we should be called. And I was like, I don't think I'm a family leader. Like, I don't even know. I don't know what that means. I didn't know what it meant, but we all are family leaders. And it may not be some grandiose place that you are, but I think this particular program helped me realize that I knew more than I thought I did. And I have a perspective that is different, and that helps me, along with the other ambassadors and other family leaders, be able to bounce ideas off of one another that we may not have ever thought about. Just like in regular families, the grandmother may do her sauce this way, where the niece has gone off to college and somebody else in college taught her how to do that. It's the same concept, just in a different environment. And so family leadership is, in every family, certain people do things differently and better than others. And that is the same in this ambassador space, as well as any advocacy space. We all have a different perspective, and that's what makes the family different.
Mm-hmm. Absolutely. Tina, Ryan, how about from either of you?
I mean, I agree completely. I have spent many years, my career is in family leadership, and I work at a parent information center. So, you know, I've spent a lot of years working with families, and what always amazes me is that when you talk with families, and they get it, whatever topic you're talking about, and they realize that they already have the knowledge, they already have the passion, they already have the experience to advocate for themselves and their families. That is like a magical moment. And I think it's the same in newborn screening, in that, you know, you have these families that you work with, and they're very hesitant at first, and they really think of newborn screening and other things as like the realm for doctors or OBGYNs or nurses or midwives. And then they realize that this knowledge is not hidden from them, that they should have it, and that they can advocate for their children. And then you see this powerful like strength that comes about, and they do begin to advocate for their children, and they do begin to say, hey, I want my child to have this newborn screening, or where is this where is this heel stick, this spot going, and asking questions, and then sharing that through their communities, which is what's important to me. One of the aspects of being a family leader is not only having that information and displaying it, but then sharing that with your sister, sharing that with your best friend, and saying, this is why your child should have this screening. This is why it's important. And, you know, sharing that information and being confident in doing that. And, you know, also joining committees, or, you know, advocating for things to be added to the RUSC if it's not there, those kind of steps. But I think it really, for me, starts small, in that confidence and in that sharing of information, is that leadership aspect. And that is just so powerful, and it really changes lives. It changes lives, and it's something that all of us can do, is just communicating why it's important, the information, the links to get more information if they have it. But for some families that I work with, they are really vulnerable families, and it takes more. It sometimes takes building confidence in them and saying, you can do this, saying you have all the skills, you have the experience, you knew something was wrong, or you knew that you wanted this done. And like, that's because, you know, you love your child so much, or you are so like, it's sometimes building that confidence too, and realizing where people might need a little extra support in order to step out into their full, you know, being as a parent, as an advocate, as an educator in the community.
Ryan, anything you'd like to add? I know you've done a lot in this space as well.
Yeah, I won't add too much, other than just to highlight a couple of things that I really loved out of both Dionne and Tina's answers. Is one, as leadership qualities that I really like. So Dionne talked about, often biting off more than she can chew, and I don't know that that's exactly true. I've spent some time with Dionne, and I think she can chew pretty good, and work her way through stuff. But for me, it's that aspiration and that hunger to kind of like see something and kind of incrementally take steps on getting to make it even better and even better and even better. I don't think I've never heard once that she wants to tear anything down. She just wants to kind of like understand where it is and make it better. So I think having a big aspiration that sometimes feels like a huge thing that you don't know how to get through, but then finding tactical ways and the right networks and people to work with to help approach the problem is one of, for sure, her leadership strengths, and one of the things I admire about her as a leader. And anybody who has those kinds of things. And then another thing that Tina was mentioning is this idea of empowerment and knowledge being the underpinnings of generating confidence for both individuals and also at a community level. And I think that those kinds of things, when I think about a lot of the problems that face us in rare disease and newborn screening in general and health in general, is we're at a really exciting time where there is new information being developed at a faster rate than ever. And generally speaking, we're also at a time where the world is more connected than it's ever been. That said, current information still disseminating, and the rate and the role that plays in developing new and correct information and having people have the same quality and level of care in different parts of of even the same city, but for sure in the world, is a challenge. And I don't think that that's one that we can responsibly put on medical professionals alone. It's something that we as a community can step into leadership roles in how we collect, compile, filter, curate, etc., the latest information, and then use that to also help steer direction and work collaboratively with these people that we've sort of traditionally said, you guys are the ones that tell us what to do, and say, no, hey, we're stepping into our role in participating in that, and we want to be a part of it. And I think that's for sure a leadership quality that individuals can lead the charge on, but also sort of reflective of a community that really has their hearts and minds in the right places and pushing in the same direction towards improved health for everybody.
Yeah, thank you for that. All three of you, really great points. Ryan as well, what I'm hearing is it's a true partnership. It's not a one-way, single direction. Newborn screening doesn't happen to families. Families are a part of newborn screening, and that means more than just the screen itself. That means from the development and improvement from the get-go all the way through the follow-up on the end and everything in between and all of the systems. And so, I think what you said is spot on and very much core and central to the discussions that the ambassadors were having throughout the program. Is, we don't want to just be an observer and share our opinion of what can be better. We want to be involved in making that change and designing and developing that change. And all three of you, outside of the ambassador program, do that in a variety of different ways. Dionne, through your nonprofit organization, Tina, through your work, Ryan, you've shifted what you've done so that you can focus on research and rare disease. And so I think all three of you are incredible examples of how you've taken that to a completely different level. So to that end, Ryan, I'd love to, you mentioned this just a moment ago, so I'm gonna turn to you for this question first. You started to touch on a few of the barriers and the challenges to families really getting involved and engaged in changing the newborn screening system. So I'd love to hear from each of you, kind of what do you see as the barriers to getting involved as families, leading within the newborn screening system?
Oh man, I could really come across as disgruntled here because I just by my nature I like to look at problems, find challenges, find opportunities in that, and that means that sometimes when I talk, it sounds like that's all I see. So I'll try to not do that anyway. And I don't have the crutch of having two smart people to go behind and just regurgitate what they say. I think the main sort of umbrella challenge is that this is still a relatively young system, being for the way that it is being used. I mean, obviously we know that newborn screening in some form has been around since 63 or so, and so we've had quite a long journey there. But really, as a widespread opportunity towards improving public health, it's much younger than that, and like we're only maybe now getting to the point where even decisions taken 10 years ago about how we collect and share data amongst states or how we share processes amongst states, let alone recognizing that, I said at the beginning, my view is that some kid born tomorrow is no different than me. Some kid born in a different country is no different than me either. The same thing's true there. So sharing information across not just states, but then also around the world towards helping everybody. It's just really hard. And there's a lot of decisions that have been made in the past that kind of handcuff our ability to do that now. And it becomes like a very slow moving thing. There is a lot of complexity to it. There's individual autonomy. What information is mine and shouldn't be shared without me explicitly doing so. What information is competitive, both either for companies working on technologies or for states competing for funding or programs competing for funding. I'd love to see a lot more sort of return to like this rising tide raises all boats kind of mentality, that like we should be in this a little bit more together. So I'd love to see, like, again, at a minimum, a lot more sharing of information and standardization of the approach for states as we look at newborn screening as a process that's not just about having getting a heel prick and testing some blood, but like our ambition should be to add a bunch of conditions. And so how do we get good at adding conditions so that it's not 10 years to add a condition even after it's on the RUSP, let alone the process to getting it on the RUSP. How do we standardize workflows so that each state isn't having to do redundant work? Some states have the budget for it and the personnel for it, but most do not, to do it really well. But like, so how do we do a better job of information sharing? And we see that, like, maybe from the background for folks that aren't aware, and I know that we have some state lab personnel on the call. There's an appetite for this, like, right? Like there's sort of like it sounds strange to call it a grassroots, but like there's a network of state labs to communicate, to trade ideas. But I'd love to see that that thing just have some gasoline thrown on it, so it can really take fire and do a lot more good, and then have that kind of mold really transfer a lot more outside of the US too. So I'd just say a lot more information sharing. I think there's a ton of stuff that completely stays out of the sticky area of like what is ethical to share about individuals' private information, that we can like say, all right, that's important too, but like let's not hold up the rest, and like let's really go forward with how do we get a lot more information sharing and knowledge developing way faster out of these programs, both on how we execute them, but then also what we're learning about from a scientific value for the conditions themselves. And I'll keep it short, and even though that wasn't that short.
No, that's great ideas, and lots of people listening into these ideas too, which probably generates even more. So Tina, how about I'll go to you next, and then Dionne will come back to you.
So, I mean, I think I approach it from an entirely different aspect than Ryan, just because, I'm at the family level, working with families. And so I think some of the challenge there is, truthfully, the families that I work with, they are vulnerable families. They are Black and brown families. They are families in poverty. They are families in Amish groups, Orthodox Jewish, families that in general do not trust medical systems, do not trust government, state government. In other ways, they have been abused, lied to. And so for me and those that, understand how important newborn screening is, just getting these families to engage and to trust, or to at least learn And then you encounter what Ryan was talking about in terms of how slow systems are and how there still is this grinding of the wheels that families don't always understand. And, professionals don't always understand. And so then it compounds it. Then it makes it that much harder to get families to want to be involved, to want to, advocate, to want to add things to because there's little confidence that it's actually going to get done. There's little confidence that it's in their best interest ultimately. So, there's a lot of like perception and like, like communication challenges and that interaction, that interplay between what's perceived as institutions and actual people, actual parents, and communities. So, I mean, that's kind of what I see.
Dionne, how about you? It's really interesting to hear. I mean, and that's exactly why we wanted to ask this question. Each of you has such a different experience with this. So I'd love, Dionne, to hear your thoughts as well.
Coming off of a long weekend of trying to do some work, Friday, I sit on a lot of advisory boards, and the reason that I'm on those advisory boards are some are as a patient perspective, some as a person that I hate DEI, but that's what they call me, someone that works in the DEI space. And it goes off of what Tina said about trust. This call that I was on over the weekend and trying to review what we were talking about, there was a woman on this call that the call was about cancer treatment that's non-chemotherapy. How can we get more Black women into this study, and just for research purposes? And one of the ladies who just got diagnosed was like, well, what's in it for me? How do I know what you're going to do with my stuff? Like, and so for many years, you have Black people and Indigenous citizens in this country whose information has been bastardized by the government, by entities that are non-government. Ryan was talking about different systems within how different states, but I talk a lot of times in C-suite hospital personnel about hospital systems don't like to share with each other, like at all. Like, it's like, who wants to say that they bark the loudest? Like, we got this over here, we don't want to do this. And so when you get into the newborn screening, you have to just like in Mississippi, I've been talking to a couple of doctors down there. You have so many system issues, shortages of doctors, no expansion of Medicaid, no Medicaid. You have people that are having babies that don't have a hospital in their county, OBGYN in their county. So if you don't have an OBGYN in the county and they're giving birth at home, how do we let them know about newborn screening, and how that chain of how the exchange of information, who's going to stick the baby, will they ever get it? Then it goes into the schools and things like that. And so we have to get I always say we need hospital systems to do a better job at being decent, right? Because everyone in this country deserves quality health care. Now, holding them accountable, my daughter hates when I go through this, but there's a whole history lesson. Go back to the Hill-Burton Act and see why hospitals need to be able to do what's right. There should not be a baby in this country that's not screened. And unfortunately, there are many for reasons other than the doctor not doing what they're supposed to just because of access. And so I would like to see hospitals being taxed to do a better job. And also when we are online or in person at the HRSA meetings, I would like to see more accountability, because when Crab A didn't get passed, I was like, I wanted to fight. I don't even have I don't have skin in the game. Like for that, it's just, you know, I want more transparency with our government to figure out how someone could listen to 2 days of testimony from doctors, parents, people, and you could just say, no, yeah, no. And you still keep your job. Like if we turn down things, you would just be like, no, she's not a good fit. We're going to find someone else. I want to know who appointed these people. Like who, everybody's like, well, this happens and this. I need names. So when I go to Capitol Hill, I can say, Congressman such and such, you voted for this person. Did you realize that these many children pass away, or they're dealing with this? This is gonna cost. And take it from an emotional level. I like to show them my estimated explanation of benefits for 2020. Medicare paid $412,000 for Dionne to stay alive in the year of 2020. So if since you want to talk dollars and cents, if we start this and have healthy babies, then we don't have to necessarily have costly and sick adults. Not that's just a general broad, but we all know that there's different reasons that adults get sick. But this was something that I was born with. And so if you are saying no to something as simple as getting stuck in the foot, when you could just let the states decide if they can't afford it, but you shouldn't be able to just say no and not have your foot being held to the fire. There's not enough transparency in government. There's not enough transparency in hospital systems, because if you call them and ask them their information about newborn screening or what they say, they'll refer you to the state. I'm asking you as an entity, what did you do? Or how did you introduce this? Because what's interesting to me also, and I'll stop here, I've reached out to 5 OBGYNs here in St. Louis to figure out how we can introduce newborn screening as a public service announcement. At what part of the pregnancy can we do that? And everyone was like, well, we don't handle lab tests here. We have to go through the hospital system because this office is owned by the hospital. And I was also told, which makes no sense, this is a Catholic hospital, and I don't think that they'll allow us to display the information. And I'm like, it's a test. And it's a test. I don't understand. Let the patient decide if they're going to not want to pick it up because of their religion, but you should not be able to make that decision.
Thanks, Dionne.
I'm sorry.
You have nothing to be sorry for. I think each of you, I heard so many just key themes through what each of you shared. And I think you really brought it home, Dionne, of trust, transparency, communication, information sharing, standardization. I think these are all huge barriers, and each of you have done an incredible job of speaking to how that's been a barrier for you as an individual, but also the families and communities that all three of you are a very close part of. So I know there's lots of people from different aspects listening in, and I think you've probably generated a lot of ideas and opportunities. And I know this was dropped in the chat box earlier, but these 3 ambassadors, there are many others who are listening in to this call and who are available. There, as I think it was Ryan that said, there is a clear desire and need for families to get involved in these conversations. And I think these three and others have incredible depth and experience that could really bring value to these conversations. And it's not always happening that way. And so I think it's, you have nothing to apologize for, Dionne, or anyone in that way. You've definitely shared some real experiences. I know we're coming to the end of our time, I should say. So I do want to give just each of you, before we bring up a few opportunities to share with the audience of how they can get involved. I'd love for each of you to just take 1 minute to kind of wrap up with any closing thoughts and really kind of focusing in on like what are you doing next? What is your, either from this ambassador program that you've been a part of or the work that you're doing, what do you plan to do next? And if you would mind sharing that with everyone, and then we'll bring up some opportunities for the audience to get engaged as well. Tina, you want to go first this time?
Sure. Yeah. I mean, like I said, it's now a part of my work. So, continuing to train doulas and give them this information, give them these tools. My doulas are Black women working in their communities. And so it helps if they know about newborn screening because their clients trust them. And because they, can communicate about newborn screening, its benefits, also about some of these challenges in a way that resonates with the families they're talking to. On the other side of my work, I'm going to be an out of hospital, provider. And so, just making sure that these newborn screenings are done, that families know about them, that they are done quickly, and the information gets to the family. And it's communicated in a way that is compassionate if there is, a problem, and that they are directed to resources quickly. So, just continuing to make that my work, part of my work and career.
I love that. Dionne, you want to go next, and then we'll wrap up with Ryan.
Yeah. My goal is, in one sentence, to make newborn screening as popular or well as I can't figure out the word, but and popular isn't the word, but how women expect the glucose screening in their pregnancy. Everybody knows that they're going to get a glucose screening for the most part. Everybody knows that that's going to come in their pregnancy journey. My goal is to make newborn screening a regulatory practice for Black people in this country, so that they know that this is something that's supposed to happen. If it doesn't happen, then they need to ask questions.
Ryan, what do you want to share?
So I mean, I guess just trying to do a bunch of things. We're in the process of publishing our work on the on data analysis from Pompe newborn screening, and at the same time, and the cool things from there is there's enough statistical power behind these numbers that we can consider them a reference of truth, that we've never had this strong of epidemiology in this condition before. And I think that that's going to be true for a bunch of other conditions. So we're in the process of trying to apply that same math to other conditions that are newborn screened. We think that if we do that the right way, that we can then unlock a whole bunch of information by being able to quantify its quality for conditions that are not screened but are genetic in basis. And there can be some cool things that come from that. In another direction, towards some of what Christina talked about, is education around families, and towards what Dionne's talking about sort of awareness and discussion in receiving a diagnosis or receiving or having any awareness around newborn screening, working with families and communities to create sort of direct common language discussion around what that looks like. So I always called it a welcoming package for the folks diagnosed, but I think it does, as both of them mentioned, need to work backwards from there to being something that you actually talk about as an opportunity during pregnancy and comes up more, so that there's education before the diagnosis. And oh well, if most people never have to or get to realize the benefit of the screen because they don't get the follow-up call that says, here's a diagnosis, or here's a flag positive, or here's a suspicion. That'd be a great way to end that conversation, is like, hey, here's something that we're going to do as a quality tool to help ensure the best health for your family, and talk about it from that light, because it really is that kind of program. And then a whole bunch of other stuff, just kind of keep talking about it, but I know we're running out of time, but there's a lot of stuff that I think newborn screening serves as the basis for investment in rare disease and accelerating the rate at which we're developing knowledge in rare disease.
Thank you so much, Ryan. I'm just trying to kind of catch my thoughts and catch my breath on everything that has been shared. And I hope that those of you listening in leave with the same feeling I do. And every time I listen to the three of you and our other ambassadors speak and share your experiences, I learn something new, and I walk away feeling both challenged and inspired. Because, through the experiences that you all have shared today and others, there is room for opportunity and room for growth. And there's a lot that can be done. Others have commented in the chat box as well, similarly, that, while over the last 60 years, I certainly wouldn't minimize how far we've come. There's still a long way to go to truly make newborn screening, equitable for all, accessible to all, treatment for all of the things that many of you have talked about as barriers. We have opportunities for family leaders like you all to get engaged in the system, to partner with people who are listening here today, and to truly try to improve and solve these barriers and the others that we didn't even discuss and talk about today. So thank you for being vulnerable, for speaking and sharing today, for opening up about your experiences, for showing that there's more than one way to get involved and to truly lead and what that means. Couple of quick things as we close and wrap up. I know we're at time. Thank you for all of you who joined us today. Hang tight for just a second. We do have a survey that we will share momentarily, and would love your feedback and thoughts and ideas for not only this webinar, but future webinars as well on these similar topics. And we did want to share a few specific resources with you all as well, for you to think about and take action. The goal of the newborn screening family education program, as well as specifically the ambassador program that was a part of that, really, as I said earlier, was to help generate awareness, knowledge, education, and connection to the newborn screening community. And we know this happens through family stories. And so the majority of our ambassadors have been kind enough to share their story, and we've been able to create a book, which you can use the QR code on the screen here to access. In this book are our family stories, our ambassador stories of how they have connected to newborn screening, how they've navigated the newborn screening system, what they've learned. And we encourage and invite all of you to check that out, to read more about it. And as Dr. Ebony mentioned in the chat, if anyone listening in is interested in connecting directly with any of our newborn screening ambassadors, please do not hesitate to reach out to us. Their contact information is also in this book as well, and we invite you to do that. We know that they're excited and eager to connect. The other thing, in the spirit of Newborn Screening Awareness Month, we have a number of resource toolkits available, both through Baby's First Test, as well as specifically from the Newborn Screening Family Education Program. We have a wealth of resources that are available to share and post on social media, to send or share in any digital communications that you may have, to share with families that you may be working with. So please take a moment to check those out and reach out if you have any questions. And then lastly, we would certainly appreciate anyone that's still with us to take a few moments to share your thoughts and feedback on this webinar. You can use the QR code here to quickly access our post-webinar evaluation. And last but not least, we have lots more planned for this month, and we can't wait to continue celebrating the past 60 years and looking forward to the future 60 as well. So our next webinar is scheduled on September 12th, and we will be discussing the importance of engaging families in newborn screening research. And then we have another webinar scheduled later this month on September 27th, where we will be awarding our Grace Awards. And we're excited and looking forward to that as well. So with that, Tina, Dionne, Ryan, thank you again for joining us, for sharing. Thank you for all of those that joined us to listen in. And with that, I hope everyone has a wonderful rest of your afternoon. And thank you again. Have a great day.